So you're big on sedation in your practice, especially on the bigger procedures like dental implants. So what levels of sedation do you have?
Well, our patients can go from just local anesthetic, oral sedation where they're sleepy, I could arouse them, or for the very phobic, we'll do an intravenous. The typical sedation, orally induced, makes these people very relaxed, and the medication that I use has an amnesic effect. So the next day, they actually don't even remember. So, I could tell them some funny stories as I'm working. If they wake up, they go, I don't remember that. Or they may wake up and go, or say something like that, they don't remember. So it works out beautifully for the patient. They're calm, they don't remember. Most importantly, they have to have a friend or a loved one take them home. And most of our patients do come.
Now you're monitoring their like blood pressure, things like that. So it's very safe.
Blood pressure, oxygen level, CO2 level, the pulse, all of these things are monitored with hand monitors, cuffs, and things like that. So yes, it's quite safe.
Now you say, especially on the big dental implant cases, it's very common. People say, I should have done this years ago. Is that right?
Unbelievable. They actually say it was way more straightforward than they thought. It was like, some of them say it was actually a piece of cake. Now I want to tell you something. There's almost no pain afterwards. Why? Because when we do the surgery on day one, there's no pressure on the gum that first night.
Okay.
They come back and I put the teeth in, and the teeth are supported by the top of the implants. So there's still no pressure on the gum.
And the gums are the part that's causing the pain.
The gum is where people will have pain when there's pressure. Even if you had a teeth taken out and you went to a complete denture, those patients are miserable when you have the hard denture pressing the gums.
Okay.
These people don't have discomfort because it's almost like propped up over the area that would give the patient some discomfort. So
don't let pain keep you from doing this. The fear of pain.
We give you post-operative medication. I have special anesthetics that we use afterwards that last 2 or 3 days, so they're comfortable. Right.
My 84-year-old father had this done. I told you this in the green room, and his big thing was didn't hurt at all. Now he exaggerates about everything.
Good.
But
that was a good one to exaggerate.
Well, that was a big thing to him that it didn't hurt, and that's what kept him from doing it. Mm-hmm. For 10 years that I was begging him to do it.
If you are wondering about that, I could tell you that it's really not that big of a deal. But I have a book of patients and names who want to tell you what it's like from their perspective. It's my favorite thing. I go, Randy, you want to speak to Susan? She'll tell you what it's like from a patient perspective. When I put my patients together, they share the information, what it's really like from the patient perspective. I had a crown done not too long ago, and I was taking a picture of the doctors working on me. And I thought it was hilarious because it's a different perspective. When you're looking up versus looking down, I mean, we have patients who want to help other patients. It's part of the love in our practice.